In today's mini webinar, I'll be talking about alopecia, the homeopathic treatment for alopecia. Now, let's look at homeopathic remedies under different circumstances under alopecia, for alopecia under different circumstances. So, alopecia after chronic headache, we have mainly three remedies: sepia, silesia, and thuja. Sepia, silesia, and thuja. Other homeopathic remedies may also come up. That is the beauty of homeopathy. Everything depends on the case, upon the individualization of each case. But most commonly indicated remedies for alopecia after chronic headache are sepia, silesia, and thuja. Now let's look at the headache of these three remedies. How is the headache different under these three remedies? In sepia, mostly the patient has headache during menses. Headache during menses, that is in sepia. You will find that in sepia. And during headache, the patient can have nausea, vomiting, and also can experience vertigo. Sepia patients are usually chilly. They also suffer from chronic constipation. Mentally, they are indifferent, and indifference is mainly to family members. So that's sepia headache. So after chronic headache, one remedy you have to remember is sepia. Moving on to the other remedy, that is silesia. In silesia, the patient starts experiencing periodic headaches in some severe disease during their youth. During their young age, they had some severe disease, and after that, the chronic headache had started. The character of pain in silesia is usually the pain will begin in the occiput and settle over the eyes. This any cold air, exposure to any cold air will aggravate the headache. The patient wants to be wrapped up warmly. The pressure of wrapping up and the warmth gives some relief to the headache in silesia patient. So after chronic headache, we have sepia, we have silesia. Now let's move on to the other remedy, that is thuja. In thuja, it is usually a left-sided headache. Left-sided headache in thuja. The patient feels that something is pressing against the painful part. So wherever it is painful, there something is pressing. Maybe a nail, maybe a button. That is thuja headache, characteristic of thuja headache. Now the headache is aggravated whenever the patient drinks tea, and at night also the headache is more. The patient gets some relief when they are out in the open air and walking about or doing some kind of activity or physical activity in the open air gives some relief to the thuja patient. Now, looking upward, turning the head backward also gives some relief to the thuja headache. So, it is the characteristic of the headache is important in thuja. Also, it is usually left sided. So, that is headache during after alopecia after chronic headache. Alopecia after chronic headache, we have mainly three remedies: sepia, silesia, and thuja. Now let's move on to the other circumstance. That is alopecia after grief. Alopecia after grief, we have phosphoric acid. Phosphoric acid. So, how do phosphoric acid patients present during after grief? What are their characteristics? Let's look at that. After grief, the alopecia patients, the phosphoric acid patient is usually they're mentally very tired. When you ask them questions, they don't answer or they'll answer only slowly. They're too tired to talk, to think. They are very tired. They don't like to be questioned. They don't like to talk with anybody else, and they have no interest in any activities in their life. So that is alopecia after grief. You can think of phosphoric acid. Next, alopecia after severe illnesses. After any severe illness, there is alopecia. Usually, after typhoid, you will find patients complaining of alopecia. So, any illness like that, the three main remedies are carboveg, thallium, and manzanilla. Carboveg, thallium, and manzanilla. Now, let's look at each of these remedies. Carboveg is usually after typhoid, after cholera, after measles, after pertussis or whooping cough. When the patient starts getting hair fall, you can consider carboveg in any of these diseases: typhoid, cholera, measles, or whooping cough. Then, after an injury or there has been a severe hemorrhage from any part, the patient starts getting alopecia after these conditions have occurred in the life of the patient. So you have to inquire the past history of the patient. When did this alopecia start in the patient? One remedy is, under these circumstances, carbo-veg. In thallium, it is usually after any acute or exhausting disease. That is when thallium is considered. You can consider thallium for hair fall after acute or exhausting disease. And thallium patients usually have either thyroid disorders, maybe hypothyroidism, or there is affection of the adrenal gland, maybe Cushing syndrome, maybe Addison's disease. So thallium in that conditions you can consider. For alopecia after severe illness, one remedy is thallium, and thallium patients could have endocrine involvement, maybe thyroid gland or adrenal gland. Manzanilla also has hair fall after acute sickness. So after acute sickness, you can consider thallium, manzanilla. Then after severe illness, another remedy is carboveg. Now, few more other circumstances. During pregnancy, alopecia during pregnancy, one important remedy is lachesis. After delivery, the alopecia comes. The remedies you can consider are calcarea carb, lycopodium, sulfur, and natramure. So after remedy, after delivery, you can consider the remedies calcarea carb, lycopodium, sulfur, and natramure. Now, during menopause, the remedy you can consider is sepia. And sepia patients during menopause, they will have the sudden flushes. Hot flushes will be there. They have this tendency to faint or they'll feel vertigo. They are weak. They feel very weak. They can have bearing down sensation. Maybe the patient even has uterine prolapse. So in that condition, you can consider sepia. And the face, look of the face is also important in sepia. Now, alopecia with eczema. With eczema, the two remedies you can consider are graphitis and calibyke. So, with eczema, you can consider graphitis and calibyke. In graphitis, the eruptions on scalp, from the eruptions on the scalp, there is discharge. It is not dry, there is always discharge in graphitis, and the character of the discharge is it is watery and transparent, but it is sticky. Watery and sticky discharge will be there from the scalp. It is offensive also. The patient has severe itching. So with eczema, there is alopecia. One remedy you can consider is graphitis. Then eczema with alopecia, another remedy you can consider is calibyke. Calibyke also has vesicle eruptions on the scalp.